Hello friends, I am Dr. Amit Gupta. I am Senior Consultant Cardiologist at Manipal Hospital, Palam Vihar, Gurgaon. Today we will be discussing about certain questions regarding heart attack and heart failure. Heart attack is actually caused by the reduction or occlusion of the blood flow in coronary arteries. Coronary arteries are actually the arteries which supplies the heart. When the blood flow in the coronary arteries, it gets occluded. Occluded means it is completely blocked, so that the blood flow is not reaching to the area beyond the blockage part, because there is no supply of blood, so the oxygen level drops down and the area starts to get damaged. That particular problem is caused by the blockage of coronary arteries, is called as heart attack. Function of the heart is actually to supply blood to all parts of the body. When the heart is not able to supply sufficient blood to all parts of the body, that leads to a condition called as heart failure. When the purpose assigned to the heart is not completed or not fulfilled, that situation is called as heart failure. Actually, these are two very different conditions, but sometimes interrelated as well. Heart attack is a condition when the blood supply to the heart gets blocked. So what happens is, when the blood supply is blocked, the area of the heart which is supplied by that particular artery gets damaged, and when it gets damaged, the heart function also reduces. Heart function, when it reduces, this leads to insufficient working of the heart, and the purpose of the heart to supply blood to all parts of the body is not fulfilled. So this leads to heart failure. But sometimes heart failure can be there in spite of having no coronary artery disease. That particular condition is called as idiopathic cardiomyopathy, where the heart muscles are actually not strong enough to give a sufficient blood supply to the body. That condition is called as idiopathic cardiomyopathy, which leads to heart failure. So that's what the difference is. Heart attack can lead to heart failure, but heart failure can also be there without a heart attack. I think both are worse. Both are actually life-threatening conditions. Heart attack itself can lead to sudden death, and sometimes we see that the person is not able to come to the hospital, cannot reach a medical facility, because the events are so sudden that within 5 minutes we lose a patient. Heart failure is a condition where the symptoms of breathlessness, they start to come, and this gives some time for the person to come to the hospital to get medical facility or medical treatment. So, but in all situations, both conditions are worse, and it's the same thing. That is actually by the symptoms. Heart attack, first symptom will be severe chest pain associated with sweating, profuse sweating and vomiting, and severe uneasiness and restlessness actually. So if these are the symptoms, then our first diagnosis becomes a heart attack. While if the person is coming in heart failure, will present with breathing difficulties, severe respiratory distress, which means he is not able to take deep breaths, or breathing difficulty is there, the saturation drops below 90%, and there might be swelling in the legs, and some chest pain may be present, may not be present. So prime symptom of heart attack is chest pain, while the prime symptom of heart failure is breathing difficulty. That is very important question actually. Heart attack, if it causes damage to the heart, will ultimately leads to heart failure. But it's not always the case. Heart attack, if the treatment is given quickly, early, within 1 hour of the symptom onset, if the treatment is received, the heart damage is barely minimum. It revives, it recovers completely, and there is no damage done to the heart. This will not cause heart failure. Heart failure will occur when there is large area of the heart which is damaged because of heart attack, and the treatment given is not within first few hours, and suppose the patient is coming after a long wait. Sometimes the patient is having symptoms in the night, but they reached a medical facility after 12 hours or 14 hours. Then the area which was vital gets permanently damaged, and there the situation of heart failure comes. So if the treatment received is early, the heart failure may not, or the damage to the heart may not happen at all. So it's vital to say that heart attack patients should receive a medical therapy as early as possible. That is a common question which is asked. So yes, it can. One can recover from heart failure, but there is classes of patients. There are certain classes of patients who have minor damage to the heart, and they are coming to the facility, and we find that the area at risk is recoverable. So there are certain tests where we can identify that the area of the heart is viable or not. If the area of the heart is viable, the recovery from heart failure can happen. But sometimes the patient comes to us in a situation where the heart area is permanently damaged. Those permanent damages cannot be recovered. So I would say that some patients of heart failure can recover completely, while there are other patients where there can be partial recovery, because these days we are having very good medical therapy system where heart failure can be managed and heart functions can get improved. Well, the therapy is very clear. I think control the risk factors. That is the prime message which I would like to give, is that if we can control our risk factors, then we can control heart attacks as well as heart failure. So the risk factors like diabetes, hypertension, smoking, these are preventable. Stress, junk food, these have to be avoided. So if these risk factors can be controlled, we can control heart attacks. Regarding the heart failure, we sometimes tell the patients to reduce their water intake or fluid intake. So if they follow that regimen, the heart failure regimen, the diet and the precautions as told by the physician should be followed, the prevention can be done. Heart attack is caused by the occlusion or the blockage of the heart arteries. So the procedures or the treatment is directed towards opening up the heart arteries. Now, there are three modalities which causes improvement in the blood flow. One, in the case of heart attack, is to give a thrombolytic therapy, or there are certain medicines which dissolve the thrombus, which blocks the heart artery. So if that is administered within first 6 hours, it may cause recovery, or they can prevent the heart attack. Second modality, and which is more reliable, and because the thrombolytic therapy is about 50 to 60% successful, there are cases where 30 to 40% cases where the thrombolytic therapy does not open the heart arteries completely. So more reliable method is angioplasty. When we say angioplasty, what we do in angioplasty is that we remove the blockage by taking a wire balloon, opening the heart blockage and placing a stent. The third way by which we can bypass the blockage is by doing a CABG, or a coronary artery bypass graft surgery. So these are the three methods by which heart blockage can be treated. The primary symptom of heart failure is breathing difficulty, and that is because heart is not able to supply enough blood to the body. What happens next is that there is accumulation of fluid, or commonly say pulmonary edema. That is because of the fluid accumulated in the lungs, because there is a back pressure and the fluid is oozed out into the lung tissue, which leads to flooding of the lungs with fluid. This condition is called as pulmonary edema. The treatment for heart failure is to remove this fluid, which is done by means of medications, where we give the medicines which increases the urine output so that the extra fluid which is accumulated in the lungs can be taken out. There are medicines which improves the heart function. So that is started, or that is given immediately to improve the heart function. Once the improvement of heart function is there, so the heart failure can be treated by that. I hope the answers given in this video will be useful to you. Information given in this video will be helpful to you in your daily routine. If you have any comments, if you have any questions, please put them in the comment box. I will be more than happy to answer them. Please like the video, share the video, and subscribe the channel. It will help us create more informative content for future. Thank you.